Hello future nurses. Confused about electrolyte imbalances? In this video, let's make sodium imbalances, that is hyponatremia and hypernatremia, clear, including causes, clinical manifestations and management using easy mnemonics so that you can never forget and easily remember these imbalances. So let's begin with our video. First, electrolyte, sodium. The normal level of sodium is 135 to 145 milliequivalent per liter, and sodium is an essential, we can say essential electrolyte in our body because it is important for acid base balance, fluid balance, and mainly nerve and muscle communication. Now, how we can remember the functions of sodium? As we know, the symbol of sodium is Na. So from N we have to remember neuro. That means in case of sodium imbalance, brain symptoms will dominate. So this is the way to remember. Now, as we studied that normal level of sodium is 135 to 145 milliequivalent per liter. So two conditions will occur when sodium is out of balance, that is hyponatremia and hypernatremia. First we will study hyponatremia. Hyponatremia, serum sodium level less than 135 milliequivalent per liter, means in hyponatremia there is decrease in sodium level below 135 milliequivalent per liter, that is known as hyponatremia. Hypo means low level. So if normal level starts from 135, so in case of hypo it will be less than 135. Next is classification of hyponatremia. Classification is based on body's fluid volume, normovolumic or euvolumic hyponatremia, hypovolemic hyponatremia, and hypervolemic hyponatremia. Normovolemic or euvolemic hyponatremia is low sodium and normal fluid volume. That means there is low sodium in body, low sodium level in the body, but the level of fluid volume is normal. Means there is no change in fluid volume, but there is less sodium in the body. That condition is normovolemic or euvolemic hyponatremia. Next is hypovolemic hyponatremia, loss of both sodium and water with greater loss of sodium. Hypovolemic means less volume. Hyponatremia means less sodium. That means there is loss of both sodium and water, but the sodium loss will dominate the water loss. That's why it is hypovolemic hyponatremia. Hypervolemic hyponatremia, more water than sodium in body. That means the water level is more. Hypervolemic means more fluid or more water in the body than normal. Hyponatremia means sodium is less. So as compared to water, the sodium is less in the body. More water, that means increase in water level, but sodium can be normal or can be below the normal level. So that is hypervolemic hyponatremia. So there are three types or three classifications of hyponatremia: normovolemic hyponatremia, hypovolemic hyponatremia, and hypervolemic hyponatremia. Next, we will study the causes of hyponatremia. Before studying the causes, we have to learn, like we have to understand that whenever there will be a disbalance in any electrolyte, whether it is sodium, potassium, calcium, or any electrolyte, the main reasons can be either the intake is less or the intake is more, or either it is related to excretion, means there is increased excretion of that electrolyte or decreased excretion of that electrolyte. If we are studying the causes of hyponatremia, means there is less sodium in the body, then two main causes can be that either the intake is less, that is why sodium is less in the body, or either there is increased excretion, means more sodium is excreted from the body, and that is why there is condition of hyponatremia. So this is very in simple terms the cause of this. Now we will study the causes using the mnemonic low salt. Now low salt is in the condition of hyponatremia. So how we can remember the causes? That in hyponatremia there is low salt. So that is the mnemonic for causes. L stands for loss of sodium plus increased excretion. That means sodium is lost. Either sodium is lost or there is means increased excretion of sodium. Now loss of sodium can be because of 4 Ds. These are again the causes of loss of sodium. 4 Ds that include diaphoresis, means there is increased sweating due to which a large amount of sodium is lost from the body. Diarrhea, we know in diarrhea electrolyte imbalances occur. Drains, NG tube suction. Whenever we do suctioning of NG tube or any drain, then more sodium can be lost from the body. Diuretics, if we have prescribed or if the patient is on long-term diuretic therapy or is taking diuretics, then there can be loss of more sodium. So that is why there can be disbalance, that is decreased sodium. O stands for overload or excess intake of hypotonic fluids. Now, what are hypotonic fluids? We know that hypotonic fluids have lower concentration of dissolved solutes than blood. So, when if the concentration of solutes is less in hypotonic fluids, that means that can cause hyponatremia. If there will be excess intake of these fluids, then hyponatremia will occur because already the solutes are less in the fluids, so that will cause less electrolytes or less sodium in the body, causing hyponatremia. W, that is for wound drainage, especially gastrointestinal. Wound, whenever there will be drainage from the wound, mainly in GI wounds, there will be increased excretion of sodium. If there will be increased excretion of sodium, then low sodium or less sodium in the body. So for LOW in the mnemonic, low, that is loss of sodium, overload or excess of intake of hypotonic fluids, and wound drainage, especially GI wound. S, next is S. S stands for SIADH, that is syndrome of inappropriate antidiuretic hormone. We know that in this condition there is water retention. When water retention occurs in our body, that means our blood is diluted because of retained water. If blood is diluted, that means as compared to the fluid volume in the body, the overall concentration of sodium is less. So that means there is dilutional hyponatremia. Why we say dilutional hyponatremia? Because compared to the fluid volume, the sodium decreases. That is why this is known as dilutional hyponatremia. So this can be a cause of hyponatremia. A stands for adrenal insufficiency. We know that adrenal insufficiency is a disorder in which adrenal glands, the glands that are located on the kidneys, don't produce enough hormones, mainly the aldosterone hormone that is produced by the adrenal glands are not produced in sufficient amount. And we know that aldosterone is responsible for sodium regulation. So if the hormone is not produced in the proper amount or is insufficient in amount, that means the sodium regulation cannot be maintained properly. So because of that, hyponatremia can occur. L stands for less sodium intake, fasting or low salt diet. We discussed at the starting that if there will be low intake of sodium, that is the main cause for hyponatremia. So low intake can be due to fasting, that means the person has not eaten for the day or is taking low salt diet. T, thiazide diuretics. Thiazide diuretics inhibit sodium resorption. We know that sodium resorption occurs in distal convoluted tubules of nephron. But if thiazide diuretics are prescribed, they inhibit the resorption of sodium in DCT, and due to that, more sodium will be excreted in the urine and less sodium will be reabsorbed in from DCT, distal convoluted tubules of nephron. That is why hyponatremia can result. So these were the causes of hyponatremia, and the mnemonic to learn this is low salt. Next, we will study the clinical manifestations of hyponatremia. For the clinical manifestations, the mnemonic is U salt loss. This is also very easy to remember. In hyponatremia, we have you means the person who is having this condition. You have salt loss. This is how we diagnose or we convey it to that person that you have salt loss. So this is a easy mnemonic to learn the clinical manifestations of hyponatremia. So let's discuss this mnemonic. U stands for urinary, increased urinary output and decreased urinary specific gravity. Now we know that uh, in hyponatremia, if there is increased urinary output, that means the person is having increased urinary output, that will automatically decrease urine specific gravity because the urine will be less concentrated. And because of this, if there is increased urination, that means increased sodium is excreted in the urine. So that is a sign or symptom we can say of uh, hyponatremia. S stands for stupor, comma, headache, confusion, personality changes. These. Now, at starting, we discussed that whenever there will be a sodium imbalance, then brain symptoms will dominate. So, because of that, when there is low sodium in the body, the brain activity is depressed, due to which the person may go into coma. This is in a very severe condition, will have headache, confusion, and personality changes can occur. Next is A, that is for anorexia, nausea, and vomiting. If there will be low sodium, then it will irritate the stomach and also will affect the digestion, normal digestion process, due to which anorexia and nausea or vomiting can occur. L stands for lethargy. We know that when there is low sodium, the patient will feel extreme tiredness and weakness, because when the sodium balance will be low, then cells can't function normally. Because, as I told you, that sodium is essential for nerve and muscle communication. If that will not be proper, then the person will be lethargic and tired. T stands for tachycardia, tendon reflexes diminished. The heart will beat faster because body will try to compensate for low blood volume due to sodium imbalances. Uh, that is why there is tachycardia, and tendon reflexes are diminished. Deep tendon reflexes, we can say, are diminished in this condition. So this is for U salt. Next we will study for loss, mnemonic loss. L stands for limp muscles, muscle weakness or cramps. Sodium, as we already know, is needed for muscle contraction. So if there is less sodium, then there will be muscle weakness and muscle cramps. Next is O. O stands for orthostatic hypotension. Less salt in body, that means low blood pressure. If there is low blood pressure, then a person can have orthostatic hypotension, due to which there can be other symptoms like dizziness or person may faint. S stands for seizures. Brain cells will swell up in case of low sodium in the body, and that can lead to seizures. Stomach cramping, that are hyperactive bowels. GI system will become overactive. That is why there will be abdominal cramping, or we can say stomach cramping or diarrhea. Because of hyperactive bowels, diarrhea will occur. So these were the sign and symptoms of hyponatremia. And the mnemonic for this was that you have salt loss. So this is easy to remember, you salt loss. For you, we studied that urinary symptoms will be there, as that is stupor, comma, like this. Brain symptoms, we can say, that will dominate. If A was for anorexia or nausea and vomiting, means GI disturbances will occur. L, lethargy, person will feel weakness. T, tachycardia. L, limb muscles weakness. O, orthostatic hypotension. S, seizures, and S is for stomach or abdominal cramping. So next, how we can manage this condition. For management of hyponatremia, we have a mnemonic add salt. If there is less sodium in the body, then what will be the management? That we have to add salt, means we have to give more salt to the person. So that is why the mnemonic is add salt, which is very easy to remember. A stands for administer IV sodium chloride infusions in case of hypovolemic hyponatremia. Now, hypovolemic hyponatremia was that both sodium and water are lost, but there is greater loss of sodium. So, if there is greater loss of sodium as compared to fluid, so we will administer IV sodium chloride infusions. We can give isotonic saline like 0.9% saline in these conditions. Next, D is for diuretics. Osmotic diuretics to promote excretion of water rather than sodium, mainly in hypervolemic hyponatremia. Now, in hypervolemic hyponatremia, that means there is more water or more fluid in the body as compared to sodium. So, we have to promote the excretion of fluid or water from the body so that there can be balance between the water and sodium. For that, we can prescribe diuretics. Mainly, the osmotic diuretics are given to the patient. Next, T stands for daily weight and intake output monitoring. This is important because we have to monitor the daily weight so that we can keep a record of fluid balance. Whether the person is having fluid deficit or fluid overload, we can we can easily assess from the intake output chart and by monitoring the weight of the patient. S stands for safety prevention measures for seizures or falls. We know that hyponatremia, in case of hyponatremia, brain symptoms dominate. So the person will have seizures, confusion, dizziness, or the person may faint. So we have to initiate the preventive measures for that. A stands for assess neurostatus frequently. We have to assess the neurostatus of the patient frequently. If patient is having any personality changes or confusion, we can detect the early signs so that we can manage that condition. L stands for limit water intake. Fluid restriction mainly. Why we have to limit water intake? If there is increased water level as compared to sodium, as we studied in hypervolemic hyponatremia, there was more water than sodium in the body. So in that case, we can limit water intake so that water and sodium balance can be maintained, and mainly the dilutional hyponatremia can be maintained. T stands for teach about diet, including high sodium food. We have to educate the patient about the foods high in sodium, including soups or the salted snacks, or sodium supplementation can be given if needed. So we have to educate about this. So this was the management of hyponatremia. Hyponatremia, there is less salt in the body, and due to less salt, we have to add more salt. So, how we can remember management? We have to add salt. A stands for administer IV sodium chloride infusion. D for diuretics. D, we have to monitor daily weight and intake output monitoring. S, safety precautions or safety prevention measures. A, assess neurostatus frequently. L is for limit water intake, and we have to educate about the diet, including high sodium. So, this was all about hyponatremia. A tip to remember is always correct sodium slowly, 0.5 milliequivalent per liter per hour, to prevent brain swelling and herniation. Whenever we are correcting any sodium imbalance, then we have to correct the sodium slowly at the rate of 0.5 milliequivalent per hour per liter per hour, because brain swelling, that is cerebral edema or herniation, can occur. This is an important tip that you have to remember. Stay tuned for easy explanation of other electrolytes in upcoming videos with Smart Mnemonics with SmartNurseGuide. Thank you.